welcome to our July Talking Lymph Live. We're focusing today on the 24th of the 7th on self-care, because self-care is 24/7. So every year, International Self-Care Day occurs on the 24th of July. And I'm very pleased to have on our webinar tonight Saeed and Diane, who are going to really help us to understand the importance of self-care and how vital it is in lymphedema management. And then I'll also tell you a little bit about our compression project that we've got starting. First of all, though, I just want to make a connection to you for you between myself and Saeed. I was very privileged a few years ago to do a big randomized controlled trial in Bangladesh and Ethiopia on adding very simple self-care activities like deep abdominal breathing and some self-massage into the program which was being taught by the global program to eliminate lymphatic filariasis. And this is where Saeed comes in. He's not actually in that photo. I think you must have been taking that photo, Saeed. But we're there with our research assistants from the Centre for Injury Prevention and Research in Bangladesh, who are our partners there. And then you also see our Ethiopian colleagues, Fikre there, who's in the photo. And we've continued, the LKN Foundation has continued to work with Fikre and Saeed to still continue this work in Bangladesh. And the ability to do that long-term connection that we've had with Saeed is part of the importance in what we're bringing to our webinar this evening. But I'm just going to let you jump in now, Saeed, and just tell us what you're doing now, because the program has moved on a little bit from when we were doing those RCTs a few years ago. Can you just give us a little bit of an update? Just while we're watching you here, tell the participants to do their 5 deep abdominal breaths 5 times a day.
Yeah, thank you so much, Jan, for your nice introduction. And thank you so much for your incredible support since 2019 to the Bangladesh LF National Program. And because of you, we were able to initiate that enhanced care. We included that enhanced care services with the WHO guidelines, and we have observed the changes among the severe lymphedema patients. Actually, in Bangladesh, community clinic have been strategically selected, play a key role to manage this severe lymphedema management at the community level. Actually, currently 43,000 listed lymphedema patients are here in Bangladesh. Among them, 31,000 are chronic lymphedema patients, and the rest are hydrocele and other conditions. These chronic patients often face significant complications, including frequent secondary infections, and day by day that worsen the swelling and can result in disability over time. Between 2019 and 2024, the program directly provided enhanced MDP care training, which we have taught from Dr. Jan, to approximately 6,000 chronic LF patients, and we have listed them. And through the supports from the partners, many of the patients, we followed them over time. And our priority was selecting those patients according to their severe stages, stage 5, 6, and 7 mostly, because due to their clinical conditions and frequent secondary infections.
This is what Saeed has been teaching, the self-massage as well as the deep breathing and leg exercises. And Saeed's role with the filariasis program has enabled him to keep connected with these communities, and some of the participants that were in those original studies that he was telling us about when we were looking at what we could do for the more advanced and severe cases. Saeed's been able to go back to those communities again and again. This is a great one.
Yes.
Change in the skin. Tell us about this person.
he's an elderly person, and he had these condition. He was trying to managing last 25 years, something like that. And interestingly, most of the patients like him actually, uh, in some point, they thought it will not be reducible, or it will not be manageable by self-care. So they they are not habituated to taking care of themselves. And most interesting thing is that most of the patients are living below poverty line and do agricultural works. So when he showed them those pictures in the follow-up, they have expressed a significant relief and happiness. They can able to see the changes in their legs. They can bend, at least they can bend and they can walk far. So sometimes they have expressed, some of the patients, they have expressed some frustration, but they are now increasingly aware that managing lymphedema is a long-term process, and we are able to make them understand it's a long-term process. As I mean, the progression at the beginning, the progression through multiple stages over time, and its management also requires a gradual and sustainable approach. So when we observe this condition and in the follow-up, we are also feel very happy that he have less secondary infections when we first include him 2 years back.
Can I ask you,
Yeah.
Said, what will he be doing? Like what is the routine that he's using to get his skin into this much better condition? What does he do
Uh,
today?
there are few things. First five things was washing their limbs with medicated soap 3 times, morning, afternoon, and bedtime. Then second is after washing, they need to dry their legs with the soft clothes or towels. And three is applying creams. If they have infections, they need to use antibiotic creams, or if they have fungal infection, obviously they need to use antifungal cream. And then apart from all of those things, the most important part that enhance care, uh, the few items was there. First one is the breathing. We
Yes.
taught them the belly breathing. They can do it in standing, sitting, and even with lying in their floor and doing other some exercises. And also skin mobilization, the second most important thing. We told them, always told them to use some coconut oil or local moisturizer oil. Use that. Do frequently that skin mobilization exercises. And the last thing, to trim their nails. And if they have any fever or any pain, but there was no leaking or nothing, something like that, we always suggest them to go to the nearest community clinics and take antibiotics
Yeah.
by advised by a professional uh, medical healthcare provider or a doctors. Yeah.
And that is something that I'm going to butt in and give a shout out to Bangladesh, because Bangladesh do this very well. It's how much support people get at this in terms of whether they've got access to antibiotics or antifungal creams. Even the booklet that you provide, the program provides
Right.
this beautiful booklet with very good descriptions of all of the exercises. And that is quite unusual. There's a lot of countries who are doing a lot less than that, and Bangladesh just always did that particularly well. So I'm that's a bit of
And
who.
also, we provide them the morbidity kit box. We call morbidity kit
Yes,
box. A
yes, the whole
big,
kit.
big plastic box
Yeah,
consisting of a few soaps, then medicated creams, oils, nail cutters, other things. And so we frequently provide. Program did not able to provide all of the patients, but they try to reach as much as possible, mostly the severe patients.
For it to be long term, you've got to have some support. It's unrealistic
Right.
to think that people will do things long term
Right.
without some kind of support. Okay, can I move on to another photo?
Sure, sure.
One of the things that when I was looking at your photos that they reminded me of, Saeed, was, we did tell them from the beginning that things would happen from the top down. And this is Fikre in Malawi, and he's explaining it in English, and then it's going to be translated. But that's what he's saying. It's going to get softer at the top first. So you kind of got to work at the top and make that softer, and then things can get softer as you go down. And then this next set of photo of yours, so just really reinforce that for me, because, look at the change around his knee, and the top of the calf. Such a big change happening. And that's where the size change will always happen. It will get smaller from the top, usually first in these long-standing cases, because you've got to soften up all that fibrotic tissue that's collected lower down. So can you tell us about this one?
This patient, we included him in 2019 where we started first our ECS activities. So when you go back in 2023 again, then we have seen the changes, and mostly the knee area become very softened, and he can able to bend his leg. And most interestingly, that ankle area reduced. You can see in the photos, the ankle area was, when we include him at that time, it was huge, but it reduced after a few years of self-care and what we have taught him.
Yeah. But I'd like to move on now and actually introduce you to Diane Lacey, who is a lymphedema therapist in Auckland. Can you just give us a little bit of a background about where you work and how it came that you got to have this referral from Samoa?
Thanks, Jen. I work in a private lymphedema clinic in Auckland. I work within a specialist centre, so there's doctors that consult out of the specialist centre. And this patient had been referred by a vascular specialist to a plastic surgeon that works within the centre, because he has an interest in surgery for lymphedema. And the patient had been referred for a debulking surgery. So this was back in 2023. So these were the pictures that were taken on the day of the consult with the plastic surgeon. And he felt that because of the size of the limb, he was unable to do a debulking surgery in a private hospital. And the limb was just too large to do any debulking surgery at this stage. So then I said, look, this would be great to be able to try and reduce this gentleman's limb volume to get the limb in the best possible condition for surgery, if that was appropriate at that point. And so then the surgeon referred the patient to our clinic. And so we had severe pain with walking, and that was probably more joint pain, and lower back pain was having to lift his leg with mobilizing. And his family would help him with his hygiene. So the treatment plan then, he came for an assessment with us in July. And at that point, we gave him the LKN Foundation Enhanced Self-Care Program, which included skincare, foot and ankle exercises, deep breathing. We showed the family how to do some effleurage, and we also discussed some dietary measures as well, just to help with some weight reduction.
Just the thing that I really want to pull out of all of that, Diane, that you didn't really say, is that you actually couldn't start your therapy until he had done his skincare, because there's no way that you could have compressed that limb.
No.
And so even before any of those other things could happen, he needed to have that self-care in place. And you know, that's where you really have to acknowledge that it's the work that he did that enabled everything else that followed.
Absolutely. We wouldn't have been able to commence that. So this is 8 weeks of self-care with the enhanced self-care program. And you can so that, thanks Jan, with the before and after photos there. And as Saeed had mentioned as well, you can see the normalization of this, you know, the skin. That was just amazing. The skin was softer. The deep skin folds. He was able to separate those folds a little bit more easily. The odor had reduced a little bit. We did have some limb volume reduction as well, and it was a little bit easier for him to mobilize, even though the limb was still very large. So yes, 8 weeks of self-care was absolutely fantastic.
And then, of course, that enabled you to do the compression bandaging. Is this before the surgery or after?
This was after the surgery. So before the surgery, we weren't able, because of the papillomatosis, we weren't able to bandage his toes separately, and we had to modify the bandaging to a boot technique with bandaging. And so the surgery was to remove the excess skin around the ankle and the papillomatosis at the dorsum of the foot that just wouldn't reduce with the bandaging and the MLD.
So this is that foot that had all the mossy lesions growing right down between the toes before.
Yes, and he could move his toes, and you could lift the papillomatosis up off the toes, but it just wouldn't reduce enough.
No.
Mm.
But the important thing is that you reduced it enough that it could be surgically removed.
Yes, that's right.
Well, the self-care is key to the CTD reduction, is key to the surgery being successful, because and that's the after.
Yes. Yeah, so this was in January of this year when he'd had the excess skin removed from the ankle and the dorsum of the foot. So this was his final day. So that was 18 months of self-care as well as combined decongestive therapy in the clinic. He came twice a week, and then his family and himself, they continued their care on the other days. He's returned home to his country, and he continues to bandage to further reduce the limb volume. And the LKN Foundation sponsored a doctor from his hometown, and she undertook the lymphoedema training program with the Doctor Border School in Auckland at the end of last year, and she has now taken over his care back home.
Fabulous when that all puts together like that.
Mm.
Thank you so much, Diane. That's such a graphic case of, you know, how you know, lives can be changed if people get the right kind of attention to these things. And I just love it that it all went back to relying on self-care at the beginning, and at the end he now has to really, you know, take on that self-care and continue it for the rest of his life, and hopefully he'll keep a really good outcome. Yeah. Mm-hmm. Okay, so I'm just going to give you a little bit of a lead in now, because we've mentioned a bit of compression, and this is, you know, quite a tricky thing to get in place when we're talking about lymphedema in filariasis and podoconiosis endemic countries. But first of all, there's a few papers on compression in filariasis. Way back in 2002, when, you know, this was pretty much when the global program to eliminate filariasis was really only just getting off the ground. And this paper is from India. India has about the highest burden of lymphedema from filariasis of any country, and they have been very early adopters of a lot of different treatments. And this was a study exploring the use of sequential compression pumps. And the findings are not surprising. The early stages of lymphedema had a much larger and a more immediate response than the later stages. And the effect was not sustained very well after the cessation of the treatment. So this study underscores the need for effective compression therapy. It can be really effective if you can apply it, but it also needs to be sustainable in the long term. You can't just go in and do a few weeks of therapy. Things are going to rebound if there isn't that therapy available long term. And things like the cost of the devices, the need for electrical power, make things like compression pumps unsustainable in most LF and podoconiosis settings. This study is one of my favourites by Bernard and colleagues in Tanzania, and they had a group of 26 people who were receiving proper CDT, manual lymph drainage and skin care, and short stretch bandages, padded short stretch bandages and exercises. They were receiving that from a clinic, being treated by a health professional, a physiotherapist. And then another group of 33 people had training in how to do all this for themselves. So they were trained for 4 days in the lymphatic drainage, in the bandaging, in the skincare and everything. And then they took it home and did it for themselves. And both groups had 3 weeks of intensive reduction treatment, applying the short stretch bandages. And then they were fitted for compression garments. And the study followed up over 3, 6 and 9 months. And this is one of the cases from the physiotherapy group. So you can see a very successful program. Bandaging, as we know, is very successful in reducing lymphedema, even in the latter stages. But the results were really interesting. At all of the stages, the group that learned to do their own treatments had the best results. Particularly, this was notable in the long-term follow-up at 3, 6 and 9 months, because these people had learned how to do it for themselves. And this really highlights the need for this community and personal ownership of the therapy. That if you want people to engage in this type of self-care, you have to give them ownership of what they're doing. People might be aware of the Institute of Applied Dermatology in Kerala. It's quite a famous lymphedema clinic in India, where they combine Ayurvedic medicine and Western dermatology. And they understand that this actually, they've done lots of big studies on this. You can see this one is 730 patients in this study. So they've got a lot of data on how successful their program is. But their program is largely based on this understanding that it really takes a whole family. People from all over India come to their clinic to get their lymphedema treated, but they can't come alone. They have to bring at least one family member to be trained in the program with them. And it's a fantastic mix of this Ayurvedic medicine. That's a terrible photo, but they do this quite firm Ayurvedic medicine. They use the Fanta soaks, so similar to what you're doing, Diane, with soaking Lataumi's skin. They use these lovely soaks, and lots of massage and yoga. It's a yoga program as well. And then they use Western dermatology. They treat with antibiotics for the infections and stuff like that. So it's a really great mix of all the good parts of everything, if you ask me. Again, a few people in LF endemic countries can afford to travel to a clinic like that, or then pay for the bandages and the ongoing supplies that they need to take home with them. This study tried to use some alternative local sources for the compression. So they used a locally made elastic bandage, but they still needed imported cotton sleeve and the foam layer underneath, which weren't locally sourced. And again, so even though they got a really good result, short stretch bandages are, I think, problematic in a lot of the communities that need this kind of compression. So wraps may be a better alternative, and these, I think, have become popular for a lot of people with lymphedema in Australia as well. I hear a lot about wraps now. And because these are more durable and they can be adjusted by the person, particularly if the person has some training in how to adjust them properly, this can be a really good self-care tool, something that can be managed at home. And this, I think I've just covered it up with the picture. This study was just only a very recent study that was conducted in Sri Lanka, and they had the people in the wraps 23 hours a day. So they were only taking them off for 1 hour a day when they were doing their hygiene routine. So the rest of the time they were keeping them on, and they were apparently very well tolerated. And I think that adding something like the wrap, which is going to give you that immediate visual reduction that people will be looking for, is something else that can be really useful in, you know, maintaining the enthusiasm and the engagement of the person to do things long term, because otherwise they just get to be a bit of a chore if you're not seeing any reduction. So that brings us to the end of our presentation part. And as I mentioned, we have established a Global Village Working Group, and we're inviting you all to join. We're working towards taking compression therapy and training in to LF endemic regions. So we'll be doing that as, if you like, compression camps. We'll take our therapists will go with all of the devices and everything that the community needs, and we'll train the healthcare workers, we'll train the families, we'll train the people. We'll leave them with enough supplies so that they can keep going until we're able to come back and do some ongoing training with them. So scan the QR code to read more and join our our Global Village Working Group if you'd like to be interested in that compression project. So I think my takeaways out of our presentations, and I'd really like to thank Saeed and Diane for putting together those images, some very powerful images of just how effective self-care can be in lymphedema. And I really worry sometimes that in Australia and New Zealand, where we have, you know, health professionals that are available to us to give us good advice, I worry sometimes that the self-care side of things is not emphasized enough, because I know from my own experience in managing lymphedema that if you have an engaged person who is really engaged in doing their self-care at home, then that makes all of your professional care all the more effective as well. And for the 20 million people living with filariasis and podoconiosis-related lymphedema, self-care is pretty much the only therapy that they've got available to them. But as we've seen from our presentations tonight, it can be really effective even without compression. We just need to have the correct information. People need to be given the correct information and support. Did you make any other comments or say anything, Diane? Any other takeaways that we didn't mention?
No, I think that's it. The most important thing is that we wouldn't have had the result if it hadn't been for the family. We wouldn't, yeah. The whole family were involved in it, which was just fabulous.
Yeah.
Right.
Yeah.
Right.
Everybody was on board.
And this is where say the community clinic in Bangladesh, I love the way that the community clinics are set up, because it is the whole village is involved. Everybody has ownership of the community clinic, and they really trust and use their community clinics, which is another great thing about working in Bangladesh. Okay, I'm going to close the meeting and say thank you both to you for making the time and helping me to make this recording, and I hope that a lot of people get to view it, because I think our message is really good, and I'd really like more Australian therapists to think about teaching really good self-care to their lymphedema clients. And happy International Self-Care Day, everybody.
Yeah, thank you. Same to you. Yeah, thank you, Jan. Thank you, Dan. Yeah.
Thank you, Saeed. Thanks,
Bye.
Jan.
Yeah.